It's Monday, August 23rd, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're looking at an article entitled Intra-Tumoral Treatment with Oxygen-Ozone in Glioblastoma, a systemic literature search and results of a case series. This is cool. It is on humans, but we have both a literature search and case studies to take a look at here. It's a lot to dive into, so let's go ahead and do that. This came from Germany. It was accepted in 2018. And here's a little bit in the abstract. Treatment strategies utilizing oxygen or ozone and generating reactive oxygen species induce cell growth inhibition in apoptosis or programmed cell death. The anti-tumorigenic properties of O2O3, remember O2O3 is just ozone, it's a synonym for ozone, are accompanied by a key role in regulating immunogenicity. So that's key, that's important as we understand how ozone works to treat tumors and to treat other diseases, is the ability of ozone, a substance that's introduced into the body to kickstart an immune response, really. And beyond that, we're going to see some of the other ways in which it works, specifically with a problem like glioblastoma, to normalize oxygenation in those areas. During the past decade, and this is, I don't want to read this whole thing, but what I want you to see is basically 25 months is the overall survival rate for somebody who has been diagnosed with this, and about 12 months following the first resection of the tumor. So 25 months overall and 12 months after the first resection. There's a lot of studies that have shown that ozone can be used as a serious adjuvant therapy in oncological patients receiving radiochemotherapy. So you can take a look at some of those if you want to go deeper. But how did they do it in this particular case? What they did was there was a port, basically a reservoir that was in the skull, and they actually injected 5 mLs of ozone through that reservoir at a concentration of 40 micrograms per milliliter directly into that area where the chemo was being injected as well. So that's how they did it. That's the protocol. How often they did it, we're going to see that in a second here. But the patient, so this is interesting. I highlighted this because there was one patient who decided to get this done right off the bat, right at the very beginning. And that particular patient, interestingly enough, had the best results. So they remained in remission. But for the other 4 who did this treatment, there was some mixed results. So overall, you'll see the results were better by quite a long shot than not doing ozone. So the patients received a median of 27 applications. So they kept going month after month after month with these treatments, once a month. And the overall median survival rate was 40 months. Compare that to the average of 25 months. And you'll notice that there was a significant result here in these particular patients. They go through some of the charts of the patients themselves and the different criteria and characteristics. They talk a little bit in here about scientific research and data that is available on other studies that have been done on cancer, so you can take a look at those as well. Here are a few points that they made about why we should use ozone or this off-label treatment with glioblastoma patients. And it's threefold, they say. 1, there was in vitro and in vivo evidence for a preference for hypoxia. So we want to normalize the oxygenation in these patients in these areas, and that's something that ozone can help do. In vitro and in vivo evidence for the treatment efficacy of hyperoxia, generating reactive oxygen species in glioblastoma. And 3rd, in vivo evidence for the treatment effect of ozone in stimulating the immune system and other types of cancer. So that's why they went ahead with this particular one. So the goal was to apply ozone right to that area to establish normoxia, thereby inhibiting proliferation and migration in addition to promoting differentiation. And that's part of what happened here. And here's a cool little note as well. Ozone is a gas that's produced endogenously by granulocytes, induced the generation of reactive oxygen species, stimulates the release of immunoactive cytokines. I wanted to note that because, again, ozone is produced by our body. They've been able to locate the ozone signature in our bodies, but the introduction of ozone to the body externally also can help create some of these effects. So we need to keep moving here. I don't have time for all of this. Here's a quick note. Therefore, the ozone application in glioblastoma may act as an immunotherapy through the enhancement of human natural killer cells. And so that's one of the ways in which it can work in these particular patients. Finally, these results in the existing evidence revealed by the systematic literature search highlighted that ozone therapy could be considered a viable adjuvant therapy in oncological patients receiving radiochemotherapy. The case series of the present study indicated the potential benefit and efficacy of intratumoral ozone application following surgery for glioblastoma. That has been a summary of ozone and glioblastomas. Hopefully this was helpful, and we will see you next week for a new installment of 5 Minutes of